Hello, everyone. Welcome to our webinar, COVID-19 and K-12 Reopening. We know this is a challenging time, and we appreciate you joining us for this webinar today. My name is Sarah Porter, and I'm the Vice President of External Affairs at Healthy Schools Campaign. Today, I'm representing the Healthy Green Schools and Colleges program, a partnership between Healthy Schools Campaign and Green Seal. Formerly called Green Clean Schools, this program leverages more than a decade of Healthy Schools Campaign's work, along with Green Seal's additional expertise, providing even more resources for creating healthy, sustainable, and effective cleaning programs. Before we begin, I'm going to quickly review some basics for today's webinar. Today's webinar will run for approximately 1 hour, and a recording of the webinar will be available to view later. We will email a link to the recording, and it will also be archived on the Healthy Green Schools and Colleges website. We're going to save the bulk of our time today for a question and answer session with our committee members. You can ask questions by typing a question into the questions box located on your control panel and clicking on the send button. Feel free to send questions through the questions box at any time during the presentations, and we will answer them during the Q&A session at the end. Throughout the webinar, you will also see a couple of poll questions. Each one will be a multiple choice question and will give you about 10 seconds to choose a response. So keep an eye out and be ready to answer when the questions come up. As you all know, COVID-19 has forced schools in all 50 states to close. Schools in 48 of those states did not reopen before the school year officially ended. Many schools are now planning to welcome students back this fall, and custodial teams are working around the clock to develop and implement policies and protocols to protect the health and safety of students and staff. The Healthy Green Schools and Colleges committee members graciously offered to share their experiences responding to COVID-19 and planning for the reopening of their school districts. Before we hear from them, let's pause and launch our first poll question so that we can try to tailor a bit of today's content and future webinars to what you, our audience, are most interested in hearing about. On your screen, you see a multiple choice question. We'll leave this up there for about 10 seconds so you can respond. What specific topic areas related to school reopening would you most like to hear about today or in future webinars? Please select all that apply. Again, we'll leave this up there for about 10 seconds. Go ahead and choose any and all answers that apply. We'll take the poll down in about 5, 4, 3, 2, 1 second to go. Let's close out that poll and see where we landed. Okay, thanks everyone for your responses. It looks like 78% of folks on the webinar today are looking for more information about strategies for proper cleaning and disinfection. We'll definitely make a point of focusing on that today as much as we can, and also in future webinars, followed by, not a lot of difference between implementing CDC guidelines, maintaining a green cleaning program in the face of COVID-19, and addressing staffing challenges. Very helpful. We will do our best to make sure that we hit on those topics as we move forward. Before we move on, please note the information shared during this webinar is for general information purposes only. The experiences and information shared today are not intended to replace, directly supplement, or formally operationalize the guidance provided by the U.S. federal government, including recommendations published by the Centers for Disease Control, the Occupational Safety and Health Administration, and the U.S. Environmental Protection Agency. We encourage you to visit those federal agency web pages if you're seeking formal instruction on how to develop or update your cleaning protocols in response to COVID-19 or any public health emergency. We will include links to these resources in our follow-up email. Today's webinar is a knowledge sharing event in which the leaders of green cleaning and building operations in K-12 districts will share their experiences. On the webinar today, we have Tony Almeida, Manager of Custodial Services at Elk Grove Unified School District in Elk Grove, California, Mervin Brewer, Assistant Custodial Supervisor at Salt Lake City School District in Salt Lake City, Utah, and Shauna Kragen, Director of Custodial Services, the Davis School District, Davis County, Utah. First, I'd like to introduce Tony Almeida from Elk Grove Unified School District in Elk Grove, California. Tony?
Good morning, everyone. I hope all of you on the call are happy and healthy. So a few things about Elk Grove. So for myself, my name is Tony Almeida. I am the Custodial Manager for Elk Grove Unified School District. We are the 5th largest school district in the state of California. Currently, we have about 75 buildings. 66 of those are schools in both elementary, secondary, and a few charter. We are responsible for maintaining about 6 million square feet of floor space each and every single day. We currently have roughly 290 full-time custodial staff and about 40 to 60 active custodial substitutes. So big job for all of us. Our current status, and I can't stress this enough, it changes daily, as I'm assuming each and every one of you on the call have dealt with it in some fashion or another. So back in March, when COVID first started, we were the first district in California to close our schools. So you can imagine the heartache from our community and supporters and parents. So we, shortly thereafter, of course, everybody else shared the same. So our staff schedules were off because schools were closed. We were still running a food program for our students, so we had minimal staff on site. We had one person, one custodial team member at each school to kind of help support our grab-and-go food program. And we all recently came back to work the beginning of May. So all of our employees are back, and I'm glad to say that we've had a really good head start in providing our routine deep cleaning services as we do every summer. So that's great, but then came the unprecedented times of how are we going to reopen? Are we going to reopen? So, and to this day, we are still undecided. We've generated tactical teams throughout our district. I think there's 12 of them. The operations, special ed, food service, there's a whole slew of tactical teams that are providing recommendations to our board. And our board meets next Tuesday. So June 30th, we will have a better guideline on how we're going to reopen, because that is when they've decided that they're going to go in close quarters and provide some type of structure for how we're going to reopen. We're all still waiting because plans are changing every single day. Between March and now, our custodial department has been focusing on plans for high touch point cleaning. We're not perfect. We have flaws. No plan is perfect, but we've had to generate a new cleaning program that focuses mainly on high touch surface cleaning. So we've taken a lot of time during this transition to redevelop our programs, to focus a lot of our energies on refreshing training. So we've done a lot of that. It's been nonstop. It's 4 or 5 trainings a day with myself and our supervisors. So that is what we've primarily been focused on. And it's worked out great. It gives us an opportunity to be out there in the trenches with our teams and update their training program as well. We're going to be very proactive with our training program, and I'll use this as an example. We're considering tent cards or some type of informational communicational path that we're going to be leaving on teachers' desks, so they have confirmation and validation that the custodial, the operations department did X, Y, Z in their classrooms. Of course, that could pose some securities and could pose some insecurities, but that is our goal moving forward, starting in August, which is potentially when we may reopen in some fashion. There's been a lot of models discussed internally with our district, but nothing has officially been released yet. There's the usual model, there's the 50-50, there's an A-B schedule that we've discussed where kids would come to school on Monday and Wednesday, and another set of students would come to school on Tuesday and Thursday, and Fridays would be an all distance learning day with some small group meetings at each facility. We are currently not hosting any outside groups. That has all been canceled. Actually, just yesterday, we've done a slow release, a phase 1 release of summer sports with some conditioning and practicing at the site level with groups of 10 or less. And it's mainly basketball and volleyball and some football. Again, in small groups, there's going to be a very strict communication chain between athletic directors and our custodial supervisors in communicating areas where students have been and staff has been, so we can go back and touch up those areas. Some of our biggest challenges through all this, believe it or not, is just trying to collect PPE. I mean, for a while there, masks were, you couldn't get a mask, so now masks are plentiful. It's gloves, at least in our region here, gloves are extremely difficult to come by, so we're working on the PPEs. And I think lastly, what we were asked to do last week was creating models. So at our elementary and secondary level, we are creating a post-COVID model and a pre-COVID model, which means traditional, room setup where things are congested and there's 35 desks in a room. So now we're condensing that and doing a new model, and we're setting up site tours with cabinet and the board with all the appropriate signage and barriers and floor markings at our school. So again, more to follow by next week, and a lot of pre-planning went into my discussion today. So that concludes my update.
Thank you, Tony, for sharing. I was taking some notes as you were talking, and so many of the challenges and things you're facing, I know so many other people around the country are as well. In particular, it was interesting to hear the continued challenge around access to PPE equipment and supplies. And I think one common thing for all school facility folks is sort of the timeline of the impending school year opening, and not sure yet. And yet at some point there will be a plan, and your team will be required to be ready for it. So certainly appreciate the challenging environment that you're working in right now. Thank you for sharing. Next, I'd like to introduce Merv Brewer from Salt Lake City School District in Salt Lake City, Utah. Merv?
Well, thank you. I appreciate the kind introduction. So I'm Mervin Brewer, and I'm an assistant custodial supervisor in the Salt Lake City School District. We have approximately 41 facilities that is now pushing about 5 million square feet. We have 106 full-time contracted vested custodians, and then we have probably about another 70 part-time folk that work for us, usually about 4 hours a day. We are a school district of about 26,000 students when they all show up. Interesting to see what it's going to be this year. So currently our status is we are planning on having school as normal on the 26th of August. However, that will depend on what happens in the state of Utah. The numbers of COVID-19 cases are spiking currently in the state of Utah, and there's talk that we may go back to full closure. So who knows where we'll be in August, but the plan right now is to be ready for August 25th for school to open. I'm going to cover ours just a little bit different, our how we're planning. So our custodians have been trained for quite some time on how to deal with infection control. But starting with this upcoming school year, I really think that we need to realign some of the terminology that we have used for many, many years in our custodial field. We've used words like cleaning for health or green cleaning or just the word clean. One of the things that we have found out through this whole COVID-19 mess is that we would go through and sanitize certain areas of a building. We would make the statement that we went and we deep cleaned an area. And shortly afterwards, somebody would go in and they'd walk into that area and they'd find some dust or fingerprints or something like that that would make them question the level of cleaning we had actually performed. I think that we need to redefine these terms and do it as simply as possible. With this new normal, I hate that term, but really that's what it is. This new normal that we're looking at. What we now have, we need to go through certain areas of the buildings that are considered high traffic areas and high touch points, and we need to sanitize them multiple times a day. And we were doing that beforehand, but this needs to be the new normal, not just at high outbreak times, but this needs to be the new normal, period. I think it's very important that we call this terminology routine sanitizing. This would be where we go through, say, an office area or a restroom area, something like that, reception area, and touch up the touch points and areas where disease transmission would be of high concern. So the next term I'm recommending to our folks that we move to is called a thorough sanitization. This is the operation that would take place normally in the evenings, performed by custodians after building personnel have left. This would be not only including the touch point areas, but also many horizontal and vertical surfaces, as can be realistically sanitized. I envision this to be more what the CDC guidelines recommend, with the two-step approach of first cleaning and then using sanitizer. This is something that would include the use of more specialized tools and equipment in the custodian's arsenal to get the job done quickly and efficiently. This would also mean that we would have to cut back on certain things like burnishing floors, vacuuming every day. That would have to be moved to more of a rotating basis in our schools, those sorts of things. Because again, the sanitization is much more important, much more of a priority. So there's another term. This third term used to be called summer cleaning. Well, now thanks to processes like team cleaning and process cleaning for health, these deeper forms of cleaning should now be called, for me, detailed cleaning sanitization, because these can best be described as what has traditionally happened in the summertime, but it really can be broken down into smaller pieces or even processes and done on a weekly, a monthly, a quarterly, or annual basis. You can clean one part and then move on next week to another part of the building. So it does get that annual cleaning. This is, for the most part, includes the total renovation and removal of dust and dirt from an area. So one other important phrase that I think we need to learn in this new normal, it's called reduction. Very important that my custodians talk about the word reduction, as in sanitization reduces. Okay, so this is the kind of training my folks are getting. Here's our official statement to the district. Our custodial staff in our facilities will be sanitizing routinely throughout the day using an EPA N-List approved product. They will be wiping and sanitizing touch points and routinely checking and sanitizing the restrooms. This will be done on a schedule of at least 4 times a day and specific to the school needs throughout the day of operation. In the classroom and other areas, the school staff will have hand sanitizer and a spray bottle with a cleaner sanitizer to hand wipe down the desks and other areas as needed throughout the day using paper towels. At the end of the day, when the building is unoccupied, our custodial team will then do a thorough sanitization of all areas used during the day following CDC guidelines. In the summer months, the deep cleaning takes place, along with thorough cleaning of all furniture, walls, floors, restrooms, carpets, and windows, etc. Our custodians routinely sanitize the areas used by summer activities, such as athletics, summer school, lunch programs, and others. Now, our custodians have been working through this whole thing, so we've had a nice long summer to get a lot of things done and get ahead of everything, so that when we start school, our schools are going to be very well cleaned and pretty and nice. And by then, we will have everybody up to speed on some of these new, the new normal protocols. So that's what I have.
Thank you, Merv, for sharing. I appreciate how you talked about sort of reframing and thinking about the terminology that we're using and how we can sort of look at this current situation and kind of help make some of these new practices more routine, and that the words that we use are important, and sort of creating a shared understanding of how we're talking about this, and that definitely impacts everyone's work. So thank you for sharing that. Definitely looking forward to hearing more from you on whether or not when August 26th arrives, if your district is fully open or if your plans have changed since between now and then.
Of course.
Okay, so before we introduce our final speaker, we're going to share another poll question. This will work the same as the last time. You're going to see a question pop up on your screen. The question is, what is the biggest challenge you face when planning for reopening? Again, please check all that apply, and we'll leave this up there for about 10 seconds to give you a chance to respond. We're going to close the poll in about 3, 2, 1. Okay, let's see where we landed. So this is really helpful. Again, we'll be using this information to help shape what resources and guidance we can continue to provide through the Healthy Green Schools and Colleges program. It definitely looks like finding practical ways to implementing the CDC guidelines is top of mind in terms of challenges to overcome. Definitely, if you have other specific things that we're not covering either in this question or that don't come up in the remarks of the speakers, please definitely use the questions box and share more detail about what challenges you're facing and what you'd like to hear more about either today or in future webinars. Okay, with that, I would like to introduce our final speaker for today, Shauna Kragen from Davis School District in Davis County, Utah. Shauna?
Thank you. So again, I'm Shauna Kragen. I'm the Director of Custodial Services for Davis School District. We have about 104 facilities, with 96 of those being schools. We have 11.5 million feet of internal space. We educate about 72,000 students and employ about 8,000 employees. Of those employees, 665 are custodial. And we also have an additional 800 sub-custodians that we can call in as needed. I'm going to do similar to what Merv did. I'm going to approach this very differently than the other two presenters. So I'm going to give you a quick synopsis of what we've done so far and then where we plan to be and what we're looking at. So on March 6th, our coronavirus planning meeting started every week. We were looking at inventory, we were looking at plans for education, looking at how to supply meals, how to supply education. On June 1st, our Fall Restart Committee meetings started. Those happen 3 times a week, and they're approximately 1 to 2 hours each. In those meetings, we have representatives of the superintendency, a representative from public relations, nursing, risk management, custodial, policy and legal, athletics, a secondary and an elementary school director, and those are the supervisors of the principals. And then we also have the health department attending those meetings. In those meetings, we've looked at all kinds of things. We've looked at our sick room protocols, we've looked at driver's ed, we've looked at extracurricular sports, how we're going to provide lunches, our basic operations of the schools, and then, of course, cleaning protocols. So just to tell you some of the standards we're going to implement across the board, we are going to ask that all students wash their hands upon entry in the school, before going to lunch, and then after returning from recess. So in the classrooms that have sinks, and luckily for us, a lot of our elementaries have those, we'll provide time and soap for them to wash their hands thoroughly in those sinks. For classrooms that don't have sinks, we'll be providing hand sanitizer. We'll also be providing mobile hand sanitizing stations in the office, counseling centers, lunchrooms, media centers, and those and any other high traffic areas. We'll be moving those mobile units if we choose to have any big events like theater performances or sports events that have spectators. We'll move those mobile units to be at the entrances of those as well. We're also looking at providing hand sanitizer to all of the students as they get onto the buses in the morning and in the afternoon. We will be providing cloth masks. We've procured about 90,000 of them. That will provide us 1 cloth mask per student and employee. We are going to be requiring them for all employees. It will be a recommendation for students, and we all know that some students can't wear them because of health concerns or issues with anxiety, or just because it's a parent or student choice and there's nothing you can do to make them wear it. But we will have them available for our students. We've installed sneeze guards on all of our office counters. We're providing the option for electronic education if the parents would prefer that option. We have looked at revising our HVAC filtration from a MERV 8A to a 13A, and we'll be also looking at how frequently we're running ventilation in the schools. We have assigned a leader at each facility who will be the head of all COVID-related responses, and we've also started doing floor markings. To give you an idea of the cleaning protocol, so we anticipate keeping this all year next year, regardless of which phase we're in, if there are students in the building. So our intention right now is to twice daily clean and disinfect the touch points on our playground equipment. 3 times daily, we'll be cleaning and sanitizing the touch points in all of our bathrooms. We'll be propping open outside entrance doors and inside classroom doors during the high traffic times. We'll be increasing the frequency of disinfecting and sanitizing touch points throughout the school all day long. Those are going to include drinking fountains, handrails, crash bars, door handles, bathrooms, the floors, the sinks, the toilets, the urinals, partition walls, locker locks, student desks, chairs, computer equipment, all that type of stuff. We'll also be sweeping each facility every day at the end of the day with an electrostatic device partnered with hypochlorous acid for an additional peace of mind. And then we also have a contaminated area protocol. So if we know that we have a potential contamination, we are going to go through the area before anything else happens and electrostatically disinfect that with hypochlorous. And then we'll do our second step, which is a heightened step of cleaning and disinfecting throughout the school. If we have a known contamination, we're going to follow the CDC requirements. We're going to make sure that we're waiting the 24 hours between the last exposure until we go in and clean the facility. We are going to open the windows if it's been less time than that, run the HVAC unit. We will be sweeping the facilities with hypochlorous before any additional disinfection or cleaning is done, just as a method of helping protect our staff. We've got very specific protocols on our hard surfaces and the porous surfaces if the area has been contaminated, and very specific protocols as far as our PPE that we're going to be requiring. If they're cleaning a contaminated area, they're going to be wearing gloves, a protective outer layer such as a gown or coveralls, safety glasses or a face shield, and if it's a known contaminated area, they will be wearing N95 masks. We also have a very specific protocol for the disposal and care of contaminated PPE, so we'll be following that very closely as well. Now, with all of that said, just like my colleague said, yesterday things were different, tomorrow things are different, so everything could be different tomorrow. But right now, that's where Davis is. Thanks so much.
Thank you, Shauna. You have quite a detailed plan. We appreciate you sharing all of that. And as you said, things are changing rapidly, but it sounds like you're in great shape at the moment. I want to thank all of our committee members for their time today, and we are going to move now into our Q&A session. Once again, go ahead and type your questions into the questions box on your GoToWebinar control panel and hit the send button. We've got a lot of questions coming in already, and we're going to try to get to as many of them as we can. First question up, Shauna, I'm gonna direct this question to you. You touched on this a little bit, but we have a question that reads, do you recommend cloth face masks or would disposable ones be okay? And if you're using cloth, what is the turnaround time? This attendee has said that they've heard that using them only once a week would be okay if they're put in the dryer in between. So could you talk a little bit about that?
Sure. So as far as cloths, the truth is cloths or masks, they're becoming very difficult to come by. Whether you're looking at cloth, disposable, N95, surgical, whatever you're looking at, masks are becoming difficult to find. If you're looking at a cloth mask, there are basic requirements or recommendations on the CDC website that are going to tell you if you're going with a cloth, it would be best if it was cotton. It would be best if it was a three-part mask. If a two-part mask is created, a filter can be inserted between the two sides, works very well. We know that from what we have heard, the cloth masks are very effective at keeping COVID to yourself. I mean, it doesn't prevent you from getting it from others, but it will keep you in a situation where if you are potentially ill, that you're not contaminating others or potentially getting them sick. So we are encouraging the cloth masks. In a perfect world, we would all have masks that we know would protect us and other people, but that's just not where we're at. As far as availability, we requisitioned those, our 90,000, almost 2 months ago. And I believe they are coming in next week. But I agree, there are some definite availability issues with the masks. Honestly, I would say you've got to grab what you can and just tell people to wear them. As far as if they can be reworn or anything like that, the CDC actually has requirements, recommendations that they have, whether it's an N95 you were using, a desk mask that you were using, or a cloth mask, that'll tell you how to take it off and how to launder it, or if you're not going to launder it, how long to keep that in an enclosed space so that contamination is off and it's safe to wear again. But a lot of that information is on the CDC website. We are recommending that they wash their cloth masks between every use.
Thank you, Shauna. That's helpful, and we'll definitely make sure that we include links to the CDC guidance in our follow-up email to make sure it's handy for everyone. This next question is for you, Merv. During your remarks, you talked a lot about sanitizing. Are you, in fact, sanitizing and not disinfecting? And can you talk a little bit more specifically about what you're using to do that?
Well, that's a really good question, because one of the things we train our custodians on is the difference between sanitizing and disinfecting, and the difference in the chemicals that is used for those operations. Quite often people make the claim that they're disinfecting, but when they're spraying and wiping a chemical, they're not disinfecting. So we try to more accurately portray in what it is we do, how that we do it, and it's splitting hairs, because remember the percentage that sanitization is and the percentage that um, uh, disinfection kills. Okay, so that's something that I think people need to be very careful with, that claim, and that's why we make the claim the way that we do, although we do use Enlist products. Okay, we use hyperchlorous based products, and we also use hydrogen peroxide based products. But we err on the side of caution with these terms. Some of the other things that we use are restroom caddies that use aqueous ozone. And due to some of the rules that are out there about claims that can and can't be made about certain products that you know are killing things, but you can't claim they are killing things due to just due to the fact that you can't make certain claims in this world. So that's why we do it the way that we do. But all of the third-party efficacy that we have seen shows that what we are using is taking care of the problem without a question.
Thanks, Merv. This next.
Sarah?
Oh, yes.
This is Shauna. I wonder if I can interject something really quickly about what Merv just said, because he made a really great point.
Please do.
I know a lot of the schools are talking about having either students or teachers or other staff members help them with the sanitation or disinfection process. What Merv just said is really, really key. If we're just handing wipes or products to people, they're quickly going to spray those surfaces and just wipe them off. As leaders in this industry, we need to make sure if we're providing products like that to other people, that they understand how those products have to work and the dwell time that's involved with them so that they're using them correctly.
Shauna, I'm really glad that you mentioned that. In fact, we have a participant who submitted a question that says, will teachers, aides, or students be responsible for sanitizing during the school day? And I think you get at something that is really key, that proper training, using the proper products and equipment in the right way is essential to making sure that they're effective, and also not unintentionally creating, additional harmful situations, particularly for students. Does anyone else, Merv or Tony, do you have anything to add on that? Would you be looking at having anyone beyond your staff responsible for helping implement your program throughout the day?
This Merv, I'll just cover that. The first part of that.
Oh, go ahead. Go ahead, Merv.
Okay. So as far as in the classroom, there will be hyperchlorous that will be provided for teachers, as well as the paper towels. And that part of between classes, that's something that they will be in charge of making sure gets taken care of. Now, the chemical we're using would be safe enough. I mean, it's safe enough to drink, so it would definitely be safe enough to use around, but our recommendation is that the teachers would be the ones that would use this product to do any of the wiping of the desks, and then the deeper sanitization, the professional sanitization that would happen in the evenings would be something that my staff would do, as well as all restrooms during the day, all touch points during the day. The only place that really anyone else is going to help would be in the classroom itself, and that they can do at their they can do it every 5 minutes if they want.
Tony, did you want to add something?
Yeah, this is Tony. Yeah, kind of in line with what Mervin and Shauna have stated already. Our goal, I guess, per se, is when school does reopen, is to have a collaborative cleaning program amongst all of our employees. I mean, 3,000 teachers compared to 300 custodians, that would help us tremendously, especially in between sessions. And again, I don't know how schools are going to reopen, and our primary focus is trying to hit as many touch points as we can in between sessions and so on and so forth, and by increasing our frequency. So kind of like what Merv said earlier, depending on your technology and state laws, because they differ. So here in California, teachers can't just have a standard Clorox wipe or any other of those wipes without being certified by the California Department of Pesticide Regulation. So custodians, the end users, they're exempt from that just because of our line of work, but we still have to be certified annually. So there's a 1-hour training course that we need to submit to the Department of Pesticide Regulation, because the products that we do use are indeed a pesticide for the obvious reasons. And we do have a hydrogen peroxide-based product. We do have hypochlorous acid, like Shauna stated earlier, and we do have aqueous ozone. And our goal is to have our entire district be converted over to aqueous ozone because it does not require DPR certification. So teachers can use it without having to be certified. It's a straightforward product. We can, dig deeper into that later, but it does have certification, third-party kill claims, absolutely safe to use, and we're launching it to our athletic department here in the next few days. So a lot of time and energy went into finding a solution where all of our employees can engage collectively, and even students at the higher grade levels, part of a life skill activity. We all have been trained to maintain and clean up your workstation. So students draw on desk and they do a lot of projects on their desk. So if they have access to a green, healthy, approved product, then they should, actively engage in cleaning their workspace. But that's where we are too. We're trying to engage our entire district and working with several union members and to help get their approval as well. So it's a process just like anything else.
Thank you, Tony, for sharing. That's making me think about one of the resources that has been sort of the foundation of our Healthy Green Schools and Colleges program is our 5 simple steps to green cleaning in schools. And the 5th step is really about sharing the responsibility and making sure that the larger school community, from the teachers, the students, the staff, the parents, all are aware of what the program is and how they can help support it. And it seems that that is sort of more important than ever, and exactly what you're describing. I want to kick it back to Shauna. On your end, are you in any direct discussions with the teachers union around sort of their role in helping execute these plans? Do you or members of your team have an opportunity to have a hand in those discussions?
Yeah, so I actually am on the committee that's discussing that with the teachers union. Whoever wrote that question actually probably has had more contact with the teachers union than the others. And just so everybody on the call has some background on that, some of our teachers unions are not in support of, or the teachers' contracts will not allow them to help or assist with the cleaning process. So yeah, we've actually been having a lot of those conversations. We've been looking at their contracts to see what they can and cannot help us with. In our district, the health department will not support the younger children in like the elementary education level, helping regardless of what the product is they're using. So we're going to need teacher support, but there are definitely some concerns with the teachers' contracts and whether or not that's going to be a violation of their contract. We are looking into that and negotiating it currently.
Thanks, Shauna. Merv, I'm going to direct this question to you. Could you talk a little bit about strategies for keeping locker rooms and showers disinfected or sanitized daily?
Locker rooms and shower rooms. So yes, so that would fall under the that would fall under the thorough sanitization that we would do. And for us, we have an aqueous ozone generated caddy that what we would do is go into an area like that and spray things down. For example, the shower room, the areas of the locker room, the floors, the benches, things like that, we would spray those down, go over them with a microfiber mop. I don't think that's the right terminology, but usually we have these microfiber pads about 5 inches wide on a pole that we use to agitate. So we would go over it with that, and then we would vacuum, because those caddies have a vacuum on them, then we would vacuum up the remaining water. So that's the primary part of it that we would do. The secondary part would be to go in with an electrostatic sprayer and the hyperchlorous and mist those areas, and that would be our protocol. It's quick, it's very efficient, and it does meet the guidelines the CDC has set forth.
Thanks, Merv. Tony, I'm going to send this question to you first, but anyone else is welcome to join in as well. Have you had any experience with, or any instances where someone on your staff has contracted COVID, and then has it been traced back to your school? And how are you sort of monitoring staff as they report to work? And the second part of that question is sort of what are backup plans for when you have staff that contract and are out, and addressing staffing shortages? Sort of a big question.
So we have not had any staff members currently that have tested positive recently, since March. So that's good. We do have processes in place with our health department, along with our health support services, that we have systems in place that when someone does test positive or any other health risks, then there's a process depending on risk levels. We try to keep things simple: low risk, medium risk, high risk, depending. And this has all been established pre-COVID with standard flu, cold, other health-related reasons. When a student or staff member contracts something, then of course we have to go through a communication path with reporting a communicable disease, and we have a rapid response team here that works out of our office to go and address those health risks with doing a thorough cleaning, sanitizing, and or disinfection. And we are currently redeveloping processes to communicate any COVID-related information to our staff. And of course, all this changes. And again, I think I mentioned earlier that we are still developing guidelines on how we can share and communicate with others outside of the custodial department.
Thanks, Tony.
So if, from Davis's standpoint, we have had employees test positive even recently, as in yesterday. We do have contract tracing through our health department. We've been very, very lucky as far as the number of cases that they've been able to do full contract tracing. And in each of our facilities, we're keeping complete lists of everybody that accesses the building. We're doing something very similar to what Tony's doing. We're looking at the exposure rate. Is it high? Is it medium? Is it low? And then looking at it based on how much exposure they've had. So as an example, if we had an employee that had tested positive, but they wore a mask the entire time they were in a facility and stayed more than 6 feet away from everybody in the facility, then I would not ask anyone else in that facility to quarantine. However, if they had been working in a proximity closer than 6 feet, they hadn't been wearing masks, anything like that, then of course we would ask those people to quarantine. But we have had some exposure in Davis.
Thanks, Shauna. Merv, this next question is for you. It reads, our district wants to use quats, quaternary ammonium compounds. Can you talk about can you provide some information about how your district arrived at the decision not to use them, so that hopefully we can do the same?
Yes, I certainly can. That makes me very sad to hear that. And I say that because at one point in time we used quats. I mean, heck, we used to use phenolics, you know. But we moved on to hydrogen peroxide and then on to on-site generation. And what made us change our mind over the years was very simple: the efficacy. What we use now knocks these things down real quick. But it's not just about chemical, and that's what too many people think. Oh yeah, if I spray a chemical, it's going to do the whole thing. No, it's about chemical and process. So sometimes you will hear in some of these different places that some of these viruses, they're real wimpy. All you got to do is basically a detergent and a microfiber, wipe them and kill them, you know, type of thing. You'll hear that in some places. You know, removal is very, very important, and a lot of people forget that. A lot of folks think, I can just spray this thing and it's going to take care of the problem. Well, yeah, with a quat, you can. If you can keep that surface wet for 8 to 12 minutes, good on you. That's great. I do not know a custodian, never have known a custodian, never have seen a custodian who can do that. They go in and they spray and they wipe and completely take away what a quat is designed to do, okay? And a lot of times now, if you look at the quats, you need to wear certain PPE, especially if you're going to mist those. Absolutely, you need to be wearing PPE, certain PPE. So for us, the decision was very simple. It's using something safer to use around occupants, around our own people, that had a very high and quick efficacy. It made absolute sense.
Thanks, Merv. Tony, I'm gonna ask you to talk a little bit more about your process and your plan for addressing high touch points throughout the day. How are you handling that? Tony, are you there?
Sorry, can you hear me now? I was muted.
Yep, that's okay. We can hear you now.
Things change. All right, things change daily, and you know, our health department, depending on what our governor reports, guidelines from CDC, guidelines from the County Office of Education, guidelines for the Department of Public Health. I mean, we have 3 or 4 different guidelines, but yet nothing concrete. So what we need to do is, obviously we need to ramp up our custodial services. And again, I think I talked about it earlier. No one's perfect. No one can be prepared for what we're currently dealing with. But what we can do is kind of revisit our cleaning program, which we've put a lot of time and energy into it. And we have pictographs with a checklist with highlighted touch points on an actual classroom. That way it gives folks a visual presentation as well. And you know, we're still developing that based on how we're going to reopen schools. We need to modify custodial work schedules to deal with the frequencies of the high touch cleaning during the day, being that we're not going to have any after school facilities, tutoring, any events, which plays in our favor, because then it allows our custodial staff more time to clean for health, which is something that we've been trying to do for years. And we all can realize that once you put obstacles in front of us with all of the after school events, tutoring, daycare, basketball, football, it becomes a problem to where all we're doing is addressing non-cleaning tasks. And, I can't speak for everybody on the call, but our schools are busy. And it's not just for education, it's for the community use as well. And I get it, but there needs to be ample time for us to do our job in order to protect our students and staff. I mean, that's why we're all ultimately here. So we, again, I don't mean to review again, but we have done some extensive work with having pictographs and highlighted touch point areas. That way there's a visual presentation and a confirmation level with teaching staff that will be placed on their desks.
Thanks, Tony. Shauna, this is a question for you. Have you ever looked at working with a third-party private commercial janitorial contractor to work in tandem with your staff? And if not, under what circumstances might it make sense for your district or another to think about doing that?
Sure. We've actually been approached by multiple third-party providers, and I'll be honest with you, my custodians are custodians. They take full custody of the building and every person in it. They don't act like a third-party provider. They're there when it snows. They're there looking at the boilers. They're changing HVAC filters. They're cleaning up vomit and they're doing regular cleaning things, but they do so much beyond regular janitorial work, both with the staff and the students, but also my people actually do a tremendous amount of stuff that would fall really into the maintenance realm. So when I first came on about 6 or 7 years ago, they approached me about that, and we did a cost analysis of what it would cost us to bring in third-party cleaners and have someone on call for 104 facilities to do snow removal, and to bring in additional maintenance people to do these functions that third-party cleaning services can't do, and all of the other functions. And what we found is that it would not be cost-effective at all. I truly believe that my custodians are invested in the students and the staff. They're invested in the student success, and that's the kind of staff that I want in my facilities. Personally.
Thanks, Shauna. We've got 2 minutes to go, and I'm going to try to sneak in 2 more quick questions. So on this next question, I'm going to ask each of you just to give a very, very quick response, yes or no. Shauna, we'll start with you. Are you planning to or currently requiring staff to be tested for COVID, and will you be taking staff temperatures?
We have discussed that. No, we're not doing either at this time. We're asking them to stay home if they have symptoms.
Okay, Merv?
No, we currently have mandatory mask wearing, and that's it.
Tony?
Yeah, the same with Merv and Shauna. We're not required at all. We're asking if staff members or students show symptoms that they do passive screening at home.
Okay. And final question, how do you know your cleaning and sanitation protocols are effective and efficient? What sort of measurement or quality assurance are you doing? Shauna, do you want to respond?
Sure. So we know it's working because we've had our processes vetted by the health department for years, not only for COVID-19, but for other situations. We do EPT testing. We do a bunch of we do a bunch of testing. We do surveys. We do all kinds of things. But we know our process is good. It's been vetted by the health department. We feel very comfortable.
Thanks, Shauna. Tony or Merv, any last comments that you would add in response to that question?
We have done ATP testing at the initial start of any product that we've changed to before we continue with that product. And besides the visual of cleaning, we validate it with ATP prior to, and then we're good to go.
Great. Merv, any quick 10-second response?
Yep, I would say right now we are going Mach 10 with our hair on fire. And so we are trusting in the CDC guidelines. We are trusting in the third-party certifications that have already been done. And where we get opportunities, we are doing ATP as well.
Thanks, Merv. We have used up all of our time, but I want to take a moment quickly to thank the sponsors of the Healthy Green Schools and Colleges program, including and especially Platinum Sponsor Diversity, for their continued support. You can see all of the sponsors here of our program on your screen. We appreciate all of them, and also appreciate you, our committee members. Thank you, Tony, Mervin, Shauna, for making time for this important discussion today. And thank you everyone for attending. My contact information is on the screen here. Please do reach out if you continue to have questions. And as I mentioned earlier, we're going to be using some of the themes and questions that emerged from today's webinar to inform our upcoming webinar on June 30th, which will be COVID-19 and school reopening. This one will be for both higher education and K-12 school districts, and I hope that you will join us. Please register on the Healthy Green Schools and Colleges website. We will also record and archive that webinar as well for later viewing. We will send out a follow-up email after today's webinar with a link to the recording from today, as well as some additional resources. Thank you again, everyone, for attending. Stay safe and be well.